So when is it the right time to medicate our fish or even place them into quarantine? And what sort of medication are we going to be using depending on how sick they are or seeing the signs first up? So those questions and more will be answered. Hi everyone, welcome back to Blue Fin Aquatics, where we share our knowledge and experience with you. So what we thought we would do, we thought we would follow on from last week as we were talking about the discus and how to breed your discus and basically keep them in the harmonious environment. But today we thought we would go through and talk about illnesses and how discus do get different kinds of diseases. But like with anything, prevention is better than the cure. So what we're going to run through today is we're going to talk about the discus and what to look out for and signs if they're going to be sick. So first of all, we'd like to mention too that, with any new fish that you do get from the shop or from friends and so forth, always make sure you've got a quarantine tank sitting there. I see it time and time again where people just get these fish and they just put them straight in their tank, and before you know it, the whole tank's diseased for whatever reason that the fish had the disease in the first place. So always, number one golden rule is always quarantine your fish when you get them, because the hardest thing is that once the sickness is in, you've got to be sort of a doctor to understand why they're sick, what's gotten in there, and try and work out what medication to use. So let's travel back with the discus for now. What we basically see, if we get new discus in and so forth, what we do basically, we put them in a quarantine tank and we keep them there roughly about 4 to 6 weeks just to see how they're going. Because sometimes too, fish do get stressed out when you move them from one location to the next. So with discus, there can be a time where they won't eat, and the best time for that is when they don't eat, is to really have a look, exactly see how they are. Are their eyes bright? Are they responsive to when you get near the tank? Are they ready coming to you for food? Those sorts of things. But if you're not seeing all this, just give it time and they will actually tell you what's going wrong. The best way in discus too to know what's actually wrong with the discus is a lot of the times the discus will sit at the back of the tank and you probably won't even see them. And the other thing is too that discus generally go to a darker colour, which means they're unhappy with what they're in and there's something really wrong in the tank. So therefore then you've got to try and test whatever is wrong in the tank. So what you've got to do then is really diagnose what's actually wrong with it. So how do we go about it? Okay, so we look at signs, we look at the discus, we look at it at its vent. Is it pushing through basically white feces that are dropping off, which the white bit is basically the lining of their stomach that is stripping all the time. So understand that with fish, whenever you see that, that is the cause of why it's all white. The other thing you've got to look at too is, discus in themselves, and we've learned over many, many years, discus do have worms regardless. Point to that is that when the fish do get sick, the worms start to become activated because the immune system has gone down. So they seem to think, okay, the immune system's gone down, so we're going to go and attack it and eat it from the inside out. So that is a big one. That is one you've got to look out for. So anything you see that coming from the vent, as in stringy white light poos basically, then you've got to act on it. And the best way around that is that we either use a metroglycol, which is metro in short terms, which is a white tablet, which is an antibiotic that we do use. Also too, sometimes too, we also give them like a potassium manganate bath, but a very weak one, because if it's ever so strong, you're going to kill your fish pretty much straight away. And the other thing is what we try and do too is put a little bit of peroxide in the water that they're actually in quarantine for, and just keep an eye on it. And the other thing is to change your water too in the quarantine tank every couple of days. Now, apart from all this and what you see in your fish, take a good look at them, because they're going to tell you something that is not right. So when you get to the point where they're darkened, they look unwell, they're not sitting with the rest of the group of the fish, this is basically what you need to do. And what we try and do too is basically, when you feel that your fish are basically sick, look at what methods you're going to be using. Are you going to be using a tablet form to break it down to scatter it in the tank? Or are you going to sort of basically liquefy it so it's in a liquid form to go a lot easier through the tank and through your filtering system? The other thing behind the filtering system too is some of the antibiotics that you do use may kill off the good bacteria that's in your filter. So we always recommend just to use a sponge filter in your quarantine tank. The other side to all this is that what we do, believe it or not, we worm our discus and our other fish basically every 3 to 4 months. And what we do there, we use the metroglycol in the food itself. So basically when they're healthy, we'll worm them every 3 to 4 months, and that gets it into their system, so then it controls the worms and any bacterial infections they do get. And if they do get bacterial infections, like they can get cloudy eye as well, that's time when you should be doing some water changes, because that tells you that you're not water changing that very often, and so forth, the water's becoming a bit stagnant. So you're going to need to do either a 25 to 35% water change. But we want to bring it back to the point where if your fish are sick or your fish are healthy, what you may be doing is you need to make up some food. We've actually showed and had a video on regards to food that we feed our discus and other fish. And that's the place where we put our metroglycol into that food so they're eating it straight away. So that's another way, because it's very hard to force feed fish if you have to get them to take liquids down, because they regurgitate it and they do drown, believe it or not, because you're shoving things down their throat and they can't breathe properly through their gills. So what we need to be looking at is using the right treatment. Prevention is better than the cure. So what we look at is, like we said, in our beef mix that we do make, we do put metroglycol in that to keep the fish going, and that's fed them, as I said, every 3 to 4 months, and this will keep your fish nice and healthy. Plus, going along with your normal water changes, they're a good help too. With cloudy eye, well, you can do a couple of things. Cloudy eye straight away is obviously your water's going stagnant, so what you can try and do is use a bit of Melifex to put that into the tank, which basically a eucalyptus base medication that you can put in there. It doesn't harm the plants or the fish at all, but what it does do, it helps clear up the cloudy eye in the fish. So that's another way of looking at different medications. And the other thing is too, that when you do medicate, read the instructions on the bottle, because you can overdose it and you can harm your fish. So I hope you've gained a bit out of that, and what basic medications that we do use here at Blue Fin Aquatics. So if you have any questions or any comments, do leave them in the comments section. And if you'd like to hit the like button so we can spread more of our good content to other people, so they get an understanding of what fish husbandry is, or aquatic husbandry, we'd like to share that with everybody. So hit the like button, and hope you enjoyed the video, and we'll see you in the next one.